I'm Bill Snyder. I'm joined by Dr. Peter Spiers from Southern Inyo Hospital in Lone Pine. And Peter, it's good to have you with us again.
Great to be here.
2019, 20, 21, so far in 22. It's been some really difficult times. You came in a difficult situation. And then the last 3 years, roughly 2.5 easy, haven't been easy, yet you've been growing, accomplishing great things against the odds, into the wind, but making it happen.
It really has happened. It has.
Can you give a few examples?
I'll talk about our emergency service.
Okay.
And that's one of the linchpins of this hospital. A critical access hospital is taking care of those critical things that happen in the community because there's not a lot of hospitals available. You know, we're a 100 square mile district. So getting quality physicians, okay, and having it staffed and equipped appropriately was a challenge in the beginning. So I did focus on that because that's a major service to the community and a major portal into the hospital. And I can tell you that the growth in the last 2 years in that department and the quality of care that we give and the amount of work we're doing with what we call performance improvement processes have revolutionized that department. We used to see 3 or 4 patients a day. I'm seeing 10 to 15 patients a day from all types of situations, something as simple as a terrible cold to we had a spinal meningitis patient yesterday. So we see everything there, and we have physicians that can handle everything. We can't treat everything in our hospital, so we need to send them to a higher level of care. But it's been amazing how there's been this turnaround. In the past, when the hospital was struggling, that was one of the areas that was poorly viewed by the community.
Yes.
And I can tell you now why people are coming here. We're getting the EMS runs, the emergency medical service runs. We have a respected emergency service.
And 10 to 15, that's got to be, say, for Northern Inyo Hospital, 40 to 60?
Oh, yes. It's 3 times. You guys, bigger market and bigger abilities and got a great ED there. But for us, it's kind of equivalent.
Very good. And I know that a lot progress has been made working in cooperation between the southern part of the county and the northern part of the county.
Very much so. We have, lots of relationships. The EDs work really well together. Our imaging program has grown so much that we needed to come to Northern to get some of our ultrasound techs trained, some new, software programs that we purchased that we chose to get hands-on training, and we worked with the folks at Northern Inyo as opposed to bringing outside people in or the vendors. So lots of little perks for us and for them. And we send most everything we can to Northern because we trust them.
Good. They've been my hospital since the late 80s. I worked there for years,
Yes.
And I have a daughter who works there still.
Yes.
Now, speaking of working for hospitals, as you're going through these changes and you're opening up, you're transitioning places, and we'll get to this in a little bit, areas that had been administrative and others, and now into patient care, are you running into problems with staffing?
We are. We're growing at a pace now where we're not meeting the demand. We have a skilled nursing facility on our campus. It's 33 beds. And locally, you won't find a lot of LVNs or CNAs, and they're the primary backbone of that facility. And so they come from Ridgecrest, they'll come from Bishop, they'll come from Lancaster. And with the way the economy is now, we've adjusted. We're paying for gas increases. We're finding ways to incentivize them, but we're still in need. So we need LVNs and CNAs for the skilled nursing facility. That limits our ability to care for patients. I have a big waiting list right now because I'm a little bit short-staffed in that area.
Okay. So if you're looking for a position and that's an area in which you're skilled, a lot of people think, oh, I don't want to work in Lone Pine. There's a lot of great perks. I have friends that I worked with at Northern Inyo that have transitioned down to Southern Inyo, and they're really happy.
We are very competitive price-wise because we need to be. There needs to be an incentive to come that far. So.
Okay. So Peter Spiers, thank you so much. I'm Bill Snyder, and we'll be back with more with Dr. Peter Spiers from Southern Inyo Hospital in Lone Pine.